New York has been the hardest hit by the coronavirus. New Jersey also hasn't been spared. Joining us now to talk more about the challenges hospitals are facing is Dr. Adam Jarrett, Chief Medical Officer at Holy Name Medical Center in Teaneck, New Jersey. And Dr. Jarrett, the town of Teaneck, where your hospital is located, is a hot spot right now. Can you tell us how things are going there and what you're seeing every day?
So we started seeing cases a little bit more than 4 weeks ago now, actually closer to 5 weeks. Unfortunately, we continue to see a slight increase in cases every day, although the rate of increase has slowed a bit. We now have over 220 patients here who have coronavirus and approximately 35 patients who are on ventilators.
Wow. Can you explain for us why New York and New Jersey have been the hardest hit?
I think it has to do with the density of the population. I think that the rest of the country is likely going to see this. I don't think anyone is going to be completely spared. Any location is going to be completely spared. And I think that because New York is such a international location, it probably saw the first cases that were seen in the Northeast. And then because of the density of the population and how close people are to each other just in day-to-day life, the infection spread relatively rapidly. We think our first cases in Teaneck were related to the outbreak that occurred in Westchester County and some connections between the community in Teaneck and that community in Westchester County.
Right. And, a lack of supplies has been a problem at many hospitals across the tri-state region. Here in New York, hospitalizations, although still high, are down right now. Is it the same case there in New Jersey? And how are the supplies at Holy Name Medical Center?
So we've been able to stay ahead of the curve with supplies, fortunately, and we've been very lucky to do that. Our materials people have really been on top of this, and we've been preparing for this outbreak since January, February. So we've been able to stay ahead of the curve, but it hasn't been easy. It has not been easy.
Yeah.
We've really relied on our materials people and the support of the community. In terms of cases being down, we're not down, but we're not up as high as we were. In other words, we continue to see more cases every day, but the rate of increase has slowed a bit. We are cautiously optimistic that maybe we're beginning to see that plateau, but we don't want to get too far ahead of ourselves, and so we're just taking it day to day.
Right. And now how are your employees doing? I'm sure their health is a big concern, but aside from their physical health, do you worry about their mental health?
We do very much. This is a real challenge for healthcare workers. They're healthcare workers that are used to taking care of very sick people, but this is an incredible large amount of very sick people. And in many cases, people that were not perceived as being all that sick to begin with. And unfortunately, the mortality rate is significant. So it is tough on our staff. We have made available for our staff psychologists and social workers and psychiatrists for those staff members who feel like they need to talk to someone. But because we feel like we're a bit of a family here, I think that family culture that is at Holy Name Medical Center really helps our staff continue to put their heads down and just do what they need to do, which is to take care of the population we serve.
Everybody's been talking about how we can restart the economy and that an antibody test may be the answer. What is your take on if a person recovers from COVID-19, are they now immune?
So we think they are, but it's too soon to know that for sure. And we do need that antibody test so we can get a better feel for that. That antibody test is going to be important in terms of when we can start to loosen up some of the social distancing rules. But I do believe that, like many of the experts believe, that it's likely that if you do have a significant infection, you likely have at least 1 year of immunity and maybe even lifelong immunity. But we're not going to know that until the antibody test is available. And we're really not going to know that for several years until we see the natural history of people who were infected with coronavirus.
All right, Dr. Adam Jarrett, Chief Medical Officer at Holy Name Medical Center. Thanks for joining us today.
My pleasure. Everyone stay well. Take care.